Did you just get your pap smear results back and perhaps it's showing that you're testing positive for high-risk HPV virus? And maybe even your doctor mentioned that there's some abnormal cells. And oftentimes, if that's the case, then your doctor might say either to wait and come back in 3 or 6 or 12 months and see if it gets worse. Or your doctor might already be talking about doing a biopsy or a procedure or a surgery to find out if there's abnormal cells and address them. No matter what, it's reason for concern because now you've got this information that's saying, wait a minute, there's a virus in your body that has the potential to cause cancer, and you don't want to just wait around and see if it gets worse. You want to do something about it. So I'm really glad you found this video, and I'd love to introduce myself. I'm Dr. Doni Wilson. I'm a naturopathic doctor, professional midwife, and clinical nutritionist, and I've been helping women with pap smears, abnormal pap smears, and healing your cervix, preventing cervical cancer as well as vaginal cancer for over 25 years. So this is what I do in my practice. In fact, I was originally trained to do primary care. So I was trained to do pap smears and guide women in that way. And then I saw that there was such a gap in the ability in helping women and giving women access to help to address the virus and prevent it from getting worse. And so I made a very conscious decision to say, okay, I'm going to completely focus my practice on helping women who already have had a pap smear and maybe already had a biopsy, and their doctor's telling them that all they can do is wait and see if it gets worse. And then I'm here to help women with everything else you can do to prevent it from getting worse. And so that's what I do in my practice, both locally in the New York, Connecticut area, and I'm helping women from around the world because actually my protocol to help women with high-risk HPV and abnormal pap smear results is something that I can teach you from wherever you are. So in this video, I want to start by helping you to understand your pap smear and biopsy results and HPV results, because I really find that important part of this healing process is for you to understand what's going on in your body. And I know that your doctor, your gynecologist, even your midwife, or whoever did the pap smear for you, likely didn't explain what your results mean. A lot of times they may not have even given you your results. So first off, I always recommend that you call the doctor's office or the midwife's office or whichever provider, could be a nurse practitioner. You call their office and you ask them for a copy of your results, because your results ultimately are your legal information. And so you should have a copy of your results so you can track it over time yourself. And that is the first part of becoming your own best health advocate. Ultimately, you are in charge of your body and your health. And you're going to, the way I see it is, you're going to a medical provider for a test maybe or a procedure to provide information to you so that you can make decisions for your body and your health. It's not up to your provider to make the decisions. It's up to them to provide information. But a lot of times providers are not providing enough information because they're in a hurry, and maybe they have training, but they don't have time, or they don't have that ability to teach you, or sometimes they simply haven't been trained to provide this information, including most providers are not trained in nutrition, clinical nutrition, herbal medicine, or how to use natural therapies in general to protect you from high-risk HPV virus. So they're definitely not trained, or most often not trained, how to give you that information. So it's no surprise that they're likely not telling you about what you can do. So I'm going to give you some of that as well in this video. The first step, though, is to understand your results so that you can understand where you're starting from, and you can see where are you on the scale of abnormality, because it is a spectrum. It's not a black and white. It's not either it's abnormal or it's not. It's more of a gradation from mild to moderate to severe. And it's really important to know, are you mild, moderate, or severe? Because that's going to influence your decision-making process about what you can do right now to help prevent it from progressing. And if it has progressed to more severe, you're going to want to take more quick action to prevent it from going into cancer. And if it is turning into cancer, then you're going to need to see an oncologist and consider also cancer treatment in addition to addressing the high-risk HPV virus. Okay, so that's why it's so important for you to understand your results so that you can be in charge of your healthcare decision-making from here on out and start taking action instead of waiting to see if it gets worse, because that is not any kind of plan, and that's not any kind of preventive plan, that's for sure. And what I see, unfortunately, is too many women who contact me and say they wish they would have found me sooner, that they had an abnormal or they had a positive HPV 6 months ago or 12 months ago, and the doctor said, just wait and see if it gets worse. And then 6 months later, it got worse. Or 12 months later, now there's abnormal cells. Now it's progressing to worse. And they wish they would have done something about it earlier. So it's, to my mind, it's never too early to be proactive to help your body protect you from high-risk HPV, because it's absolutely possible for the human body to protect us from high-risk HPV virus. Absolutely. The research shows it, very well documented, and there's so much you can do. Then it becomes more a matter of having someone like me to guide you to do it effectively. Then I'm going to be able to tell you more about how to do that. So I have some actual slides here to show you, because I want to teach you how to understand your pap smear results, your HPV results, so if you have your results in front of you, pull them up, and I'm going to be teaching you what you're looking at. So when you go into, like, a lot of times women say, how do we test for HPV? So right now, as of 2025, the most common way that women are being tested for high-risk HPV virus is when you go in for a pap smear, right? So you might be thinking, okay, I'm going for a pap smear, but your doctor is going to do a pap smear result, which looks at the cells on your cervix, and also they're going to do an HPV test. So it's actually two different tests that they do at the same time. In years past, doctors didn't always do an HPV test, but now more and more, really the guideline is that the doctor should do a test for high-risk HPV virus when you go in for your exam, whether that's every year or every 2 or 3 years, depending on your age and your risk factors. I believe they should be doing a high-risk HPV virus even from the time you become sexually active until the rest of your life. But usually it's more like between early 20s to early 70s. But I would say this is something that women should know about, is actually now sometimes doctors are even doing a high-risk HPV virus test before they do a pap smear, because what we know is high-risk HPV is associated with 99% of cervical cancer. So if you test positive for high-risk HPV, then there's reason to see, how are your cells on your cervix doing? Are they being affected by the virus? So the guidelines are shifting at this point in time. And so you might, when you go in to see the doctor or provider, they might be even prioritizing that HPV test even more than the pap smear. But the pap smear is where we get, they put in the speculum and they take a sample from your cervix. They're just taking a gentle sloughing off what I call the face of the cervix and right inside the opening of the cervix. And they look then the pathologist looks under the microscope and they can see what do the cells look like. Because what happens with the high-risk HPV virus is the virus has the ability to hijack the cells. It literally goes inside of your cells and it can go into the nucleus of the cell. It's a DNA virus. And that's why it starts to change the cell, and it gradually can cause the cell to look more and more like a cancer cell. So when we're looking at the cells, that's how we can see if they look like they've been affected by HPV. And I'm going to show you some example pictures here in a minute. So the things you need to know is when you go in, your doctor, you should do a pap smear of the face of the cervix and the inside of the cervix called the endocervical canal. They should do an HPV, high-risk HPV test, which tests for as far as we know at this moment in time, 14 types of high-risk HPV strains. There's 14 types they should test for. And then if they see an abnormality on the pap smear and HPV test, that's when the doctor may talk about what's called a colposcopy, which is a biopsy of the cervix. And that's a slightly different exam where they're going to use, they're able to visualize more closely where there might be abnormal cells and then do a biopsy of specific areas of the cervix to take an even closer look at the cells to see if they're looking like abnormal cells. So they don't always need to do a biopsy, and the decision about doing a biopsy can depend on your doctor and your risk factors and your fear. If you're feeling really worried about this, the doctor is more likely to recommend doing a biopsy. And your history of if you've ever had abnormal cells before, and if how long you've been testing positive for high-risk HPV. So there's several factors involved in that decision to do a biopsy. But if they see any abnormal cells on the pap smear, to me, it's very good idea to do a biopsy because the pap smear is considered to be like a screening exam, and the biopsy is considered to be the most specific way to identify exactly what do those cells look like. And that's what you want to know. You want to know where exactly are those abnormal cells. Again, I'm going to teach you all about that in a minute. So when you get the pap smear back, we should see really the pap and HPV test. You should see 4 things. First of all, it should say on your report that it was satisfactory for interpretation, meaning they got a good sample. Number 2, it should say that they see that the endocervical cells are present. As I mentioned, we need to see the cells from the face of the cervix and inside the cervix. If they didn't get those cells, they should really repeat the pap smear. And number 3 is, did they see any abnormal looking cells? Number 4 is where they're going to report on whether they identified HPV. And the HPV testing that's available now is very sensitive mRNA type testing. So they can actually identify the virus based on its DNA, right? Its genetic code is what they're looking for. So they're looking for actual presence of the virus. So here's an example test result. It says adequate, satisfactory sample, but the endocervical zone, you notice, says not identified. So this should actually be repeated because they didn't get the endocervical zone. So this is what you want to, if you see that, the doctor's office should ask you to come back and repeat it. The third thing is, it's going to say whether there's abnormal cells. And so you see down here where it says atypical squamous cells of undetermined significance. That's the part where they're talking about cells that look a little bit different than healthy normal cells. I'm going to teach you in a minute what that means, but it sounds complicated, right? It's a long name, atypical squamous cells of undetermined significance. And actually what I find that the best way to understand what that means is it means inflammation. It means that the cells look inflamed. And the important thing to understand about this type of cell is that it might even be caused by something other than HPV. When we say atypical squamous cells, that could even be from a yeast infection or BV or low estrogen. There's multiple causes. So this is not always only caused by HPV. So that's why it's important to look down below here and see that it says the 4th thing is HPV DNA high risk detected. This tells us that there is HPV present. It doesn't tell us exactly which of the 14 strains, but it tells us that at least one of them is present, okay? So that's how you start to learn how to read these. Now, every lab doesn't do it exactly like this. It's going to look slightly different. So don't be surprised when you look at your results. The format's going to look different, but we're looking for those key pieces of information somewhere in their format, whatever that lab's format is. Okay, so they don't have a standardized format, but they do have standardized information that should be present on the report. So this is your chance to write it out for yourself. What is those 4 pieces of information? What does it show on your results? And now you can create your own tracking method. You might even want to put it into a chart or a system where you can keep it on your computer or in a file so that you can keep track of what your results are over time. A really important way for you to be proactive and an advocate for your own health. Because this way, when you go back into the doctor's office, you'll know what it was, and you'll know what they're talking about, and you'll know what questions to ask. You're going to be way ahead of the curve by having this information. I know how scary it can be when you get a pap smear result that shows positive for HPV and potentially abnormal cells. It's hard to know who to trust and where to get information to help you solve it. That's exactly why I decided to do something about it. I'm Dr. Doni, and after helping thousands of women over the past 2 decades to clear HPV to negative and keep it negative, I decided to create the HPV Kickstart program. This step-by-step online program is designed to teach you the essential knowledge you need for your body to heal itself. You'll get access to a comprehensive series of videos that will help guide you through the diet changes you can make, the supplements to take, as well as ways to address the underlying causes of the virus. You can clear the HPV virus. Just go to drdoni.com/kickstart or use the link below to get started. I'll see you there. So I want to go through some of the medical terms you might see on your report because these are pathology reports, so they're going to use a lot of scientific terminology. And some of it sounds scary, but it's actually not scary. Like the word benign, BENIGN, actually is a word for normal, healthy cells. That's what we want. So benign is actually a good thing. So if you see the word benign, you can put big smiley faces around it. And if you see the word squamous cell, that just is the name of a normal cell, right? So if you see squamous cell, that's not a problem. That just means they're looking at the right cells from your cervix, from your body. So squamous cell is okay. Epithelial cell, that's a good thing too. That's the name of the cells that line the inside of our body, not just in the vagina, but other areas of the body too. So those words are all good things, right? Now, if it turns into the word intraepithelial lesion, the word lesion means there's an issue, right? If you have a lesion on your skin, it means there's a sore. So an intraepithelial lesion means that there's an abnormality in the epithelial cell, okay? So intraepithelial lesion means it's not telling you anything specific about it at that point. It's just telling you there's something abnormal about the cell, right? So we start to get a little bit of information, right? We go, okay, there's an issue, but it's still not specific. The word dysplasia also is a way of saying abnormal cells. The word dys in Latin is for abnormal, and plasia is cell. So dysplasia, those are abnormal cells. So we go, okay, if there's dysplasia, it means there's something abnormal going on. The words malignancy and neoplasia mean cancer, right? So what you might see in your results is no malignancy present. That means there's no cancer present. Or lack of neoplasia, no cancer, right? So sometimes you'll see those words. Or you might see neoplasia or carcinoma. Carcinoma is another word for cancer. And that's when you start to go, okay, wait a minute, are these cells looking like cancer or carcinoma? That's when we are, we're at the higher end of the range of abnormality. Atypical, as I mentioned, the word atypical means the cell looks inflamed, right? So a cell can look inflamed for many reasons. So atypical just means that the cell looks reactive, or sometimes it'll actually say in the result, reactive cell. There's some other words too, like chyliocytosis, which is spelled with a K. So sometimes you'll see some of these words that mean where they're looking at the cell and the cell looks like it's inflamed and reactive, and that could be caused by the HPV virus. So sometimes you'll see words like that that help us understand maybe if the cells are reacting to the virus, but they might not yet be causing it to look more like an abnormal cell, right? So it's all, remember, it's all on a gradation from normal to gradually progressing to highly abnormal or severely abnormal cells. This is the range. So ASCUS, you see here, ASCUS is simply an acronym for atypical squamous cells of undetermined significance. ASCUS, or a lot of times we'll say ASCUS. And ASCUS, again, it goes from normal, and then the next step on the scale would be ASCUS, and that's a level of inflammation. And after ASCUS, it goes to what sometimes is referred to as low-grade abnormal cells, right, or mild abnormal cells. And now the old terminology is low-grade or LSIL. LSIL is for low-grade cells, right? So if you see LSIL, it's the same as the new terminology, which is CIN1. When you see the C, that's representing the cervix, right? So we know they're looking at, the C means they're looking at cells on the cervix, and the IN or the IL means it's an intraepithelial lesion, right? It's a abnormality in the cells of the cervix. So again, when you see the CIN1 or CIN2, now it's progressing to more severe, right? CIN1 is low grade, then CIN2 is in the middle, and CIN3 is on the higher end of the gradation of severity. And so it's CIN1, then CIN2, then CIN3. Now, a lot of times, the old terminology of low grade or high grade is still used. A lot of labs still use that, and a lot of doctors still use that. So don't be surprised if your pap or your biopsy even might refer to low grade versus high grade. So I'm teaching you both sets of terminology so that you can understand them both. And to me, the really important distinction to understand is that there's a line we draw in the sand, so to speak, between low grade and high grade. And that line in the sand is telling us whether we need to be more proactive about removing the abnormal cells. So if they're mild or low grade, or if it's ASCUS or CIN1, then your doctor is not likely to talk about doing a procedure to remove the cells. They're more likely to say, come back in 6 months and see if it gets worse. Once it crosses that line, and you now are going into CIN2 or CIN3, which are both considered high-grade abnormal cells, now the doctor is likely to start talking about needing to have a procedure to remove those cells. Either simply removing the cells or potentially removing part of your body, like removing part of your cervix, or even removing your uterus and cervix with a hysterectomy, right? Because now they're thinking we need to remove those cells before they turn into cancer. Now, if it progresses past CIN3, then that's where you're going to start seeing the terminology carcinoma in situ, which is right before it turns into cancer, or cancer cells, or carcinoma or adenocarcinoma. And that's when definitely they're going to start talking about surgery, but they're also going to talk about treatment for cancer. And I also want to mention that it's possible for these abnormal cells to happen in other areas of the body besides the cervix. It could happen in the vagina, in which case the terminology is going to be VAIN, or vaginal intraepithelial neoplasia, or it could be VIN if they're referring to cells on the vulva on the outside, or it could be with an A if they're talking about anal cells, right? So the first letter changes depending on the location. So it could be the vulva, the vagina, the anal area, and potentially other areas of your body. But most importantly, I want you to understand when you're doing a pap smear, we're looking at the cervix and potentially the vaginal cells. If you've already had a hysterectomy and the cervix was removed, then the doctor's going to be testing the vaginal cells and the area where the surgery was. So just so you have a sense of those are variations that could be happening in your case. But the majority of you, those of you who are going for a pap smear, they're going to be talking about CIN 1, 2, or 3. And interestingly, HPV virus tends to affect the cervix before these other areas. So it's very interesting as a virus that it tends to go to the cervix. Rarely do I see it affect the vaginal cells before it affects the cervix. It can happen, but most times it'll affect the cervix first, which is why we're focusing on doing the pap smear first. And really, the doctor could also be taking some vaginal cells. They should do, when they do a pap smear, they should do the cervix and get some vaginal cells too, to make sure if, in case there's some abnormalities in the vaginal cells at the same time. Okay, so here's the picture that I want to show you, the visual, so you can really see visually what this is looking like. So on the left, we see, so here's cervical intraepithelial neoplasia. Again, that's CIN. The normal cells on the left are looking pink and round and nice circular, happy, healthy cells. And down below, you see how that looks when they're stacked up in the tissue in your cervix. If you were looking under a microscope, right, you would see these nice pink, round, happy cells. When the virus goes in and starts bothering the cells and taking over the cells, then, and what you don't see in this diagram is the next step would be what's called ASCUS. Between normal and CIN1 is ASCUS, which is when there's inflammation in the cell. That's low grade. CIN1, the next one, that's also low grade. And I'm going to tell you in a second here, what can you do about that? Then if it goes from CIN1 to CIN2 and you see that the cells just start to look more abnormal shape, the nucleus looks like a darker color, that's what they can see under the microscope. And they say, now it's looking like CIN2, or maybe it looks like CIN3, or both. Sometimes we see both in the same cervix in different areas. So now there's high-grade cells present or more severe dysplasia. Those are some terms you'll see in your results. And once it goes to CIN2, 3, that's when we want to say, okay, we want to help your body to slough off or get rid of those abnormal cells so that your body can grow new healthy cells. Because the body can grow new healthy cells in your cervix just like you grow new healthy cells all over your body all the time. So I hope that helps you to understand what is the gradation of abnormality that you might be seeing on your test results. And the goal is, from my perspective, my goal, and the doctors are not thinking this way because they're not thinking about how can we heal your cervix. They're thinking about, is this progressing and do you need a surgery? I'm thinking, how can I help your cervix heal, right? So my job that I've given myself is helping your cervix heal. Because I see from my patients, I've helped thousands of women, I see their cervix can heal. So I want to go down the scale. If you come in and it's at CIN2, 3, my goal is to help you heal your cervix back down to normal. If you come in and it's CIN1, we're going to work on going back to normal. And I see time and time again that the cervix can heal. It can reverse. Your body can get rid of these cells and you can go back to having healthy cells. So I want you to know that's possible. And the doctor's not likely to tell you that. So let's talk about what do you need to be thinking about to heal the cervix, right? How do you get that healing to happen? If it's ASCUS, which is inflammation, or CIN1, so it's low grade, your doctor is not likely to talk about doing any kind of procedure. They're likely to say, come back in 6 months. So they might recommend you do a biopsy. And if the biopsy says the same thing, they'll still say, come back in 6 months. Now, I want you to know your cervix can heal on its own. And I have a whole protocol I use to help with that, including diet changes, lifestyle changes, as well as supplements, oral supplements, in a very streamlined, strategic, clinical protocol based on research and clinical experience of nutrients, herbs, and natural mushrooms and other natural products that help your whole body heal and your microbiome heal, as well as vaginal suppositories that contain nutrients, herbs, and probiotics to help you heal directly on your cervix and in your vagina, because that's where the virus is located, and we need to help your vagina be as healthy as possible to protect you from this virus, so your body can push that virus out and prevent it from coming back again, and your whole body can support you to do that. So that's definitely what I would recommend. If you have ASCUS or CIN1 and you're testing positive for HPV, we got to start that protocol now. Let's take this time between now and your next pap smear to take action and prevent it from getting worse, but not only prevent it from getting worse, but let's help it go down the scale towards normal. Now, if it is already showing CIN2 or 3, either on your pap and or your biopsy, I would say also we need to help your body get rid of those cells. Now, you could go to the gynecologist and they will likely be talking about doing either a LEEP procedure, or in some countries they call it a LETS procedure, which is a way to remove the cells. It can cause some scar tissue, so that's important to know. And it doesn't kill the virus, so it could recur, but it is something that the doctor's office can do. If you've already had a LEEP or LETS procedure, then the doctor might end up saying, or if it's affecting more of your cervix, more surface area of your cervix, they might start talking about doing a procedure called a conization or cone biopsy or cold knife, which is when they actually cut part of your cervix. So they remove part of the cervix. So it's a more advanced procedure than a LEEP. And then the other thing they might start talking about, especially if you're over age 45 or 50, is they might start talking about a hysterectomy to remove the uterus and the cervix, because the doctor is trained to say, hey, if you're over childbearing age, then let's just remove your cervix and uterus so that those body parts are gone and the virus can't affect them. The problem with that strategy is, again, even when you do a surgery to remove the cervix and the uterus, it doesn't remove the virus. So you still have to get pap smears, and the virus could then decide to affect vaginal cells and cause abnormal cells vaginally. And I talk to women that have had that happen all the time. So it's important to know that even though it might seem like, oh, I'll just get a hysterectomy and this will be all gone, I want you to know that that might not be the case, because the virus won't be gone and it can cause abnormal cells again. So, and a lot of women I'm hearing from are saying, hey, even though I'm over 50, I want to keep my uterus. I don't want to just have a hysterectomy. I'm not okay with going through surgery to remove my body parts. I want to keep my uterus even over 50. And so more and more women are saying, what else can I do to avoid having a surgery and avoid having a hysterectomy? And I agree with you. We only want to have surgery, do surgery if we absolutely have to. So another option, if you're testing positive for CIN2 or 3, I want you to know that there is an herbal nutrient natural approach. It's called escharotic treatments. And I have another video all about escharotic treatments. And so that's a good video to go watch if you're in this situation. I absolutely recommend learning about escharotic treatments as an option. There are not very many practitioners who are trained to offer escharotic treatments. Definitely your gynecologist is not going to be trained in that. That's not something they learn in medical school. I learned it because I'm trained as a naturopathic doctor and midwife. And so I trained how to do escharotic treatments over 30 years ago and have been doing thousands of them over the years. And so I'm someone who is trained and can help you with escharotic treatments, even from a distance. And I also train other practitioners how to do them. So, because I feel like they should be more accessible for women and more available because they can be so effective. I find that ascortic treatments are very effective at removing the abnormal cells and helping to get rid of HPV virus, both. And it's using herbs and nutrients, and it doesn't cause scar tissue or damage to the cervix. So now it's not a single treatment, it's 10 treatments. So it's usually 10 treatments over about 6 weeks. And so it's more time intensive and it's not covered by insurance. So it's time intensive and out of pocket, but it does allow you to help your cervix heal and avoid a procedure. So if that's what you're looking for, definitely reach out to my office and we can look at your case and consider whether that might be a good option for you. So here's the key is, if your results have crossed that line into more advanced, right, more severe, CIN 2 or 3, that's when we would consider ascortic treatments for the cervix. Ascortic treatments are not used on the vagina, and they're not used if it's more severe than CIN 3. So if it's carcinoma, we're not going to be able to do ascorotics. So that's why it's so important to catch this before it turns into cancer, and if you can catch it before it turns into CIN 2, 3, even better, because we can help it heal without using ascorotics. We can help ASCUS and CIN 1 heal without needing to do ascorotics. So this is your chance to really journal and write about, what did your doctor recommend? Have you had any procedures already? What did they find? What have you thought about this concept that you could do a procedure to remove the cells, but the virus needs to still be addressed, right? So we can address the cells, but we still always have to still address the virus also. So when I work with patients who have cancer, cervical cancer or other kind of cancer, they might be working with the doctor to help them with the cancer, and then they're working with me to help them address the virus, because the conventional medical system isn't addressing the virus. But there's so much we can do to help protect you from the virus, to get the virus to negative and stop it from causing abnormal cells and prevent it from coming back again in the future. In fact, here's an example case of a woman I helped who was age 54. I want to thank you for all your support. I have good news to share. I did a colposcopy, which is a biopsy, and it came back negative. Your protocol worked. It helped me learn a lot about my body. Thank you so much, Dr. Doni. So that's what's possible, right? That's what's possible when you put in the focus, you prioritize yourself, you get working with a practitioner who can help you to be proactive in a very strategic way to understand where you're starting from and what are the best next steps for you to help your body heal and protect you from high-risk HPV virus. So I hope that has been helpful for you to understand your test results and understand what the pap smear means and how the virus affects your body, the gradation from mild, moderate to severe, and empowers you to know that your cervix can heal and your body can protect you from high-risk HPV. And I believe that cervical cancer is preventable because of the cases I've worked with, just like the one I just shared with you, time and time again. When I guide women through this process, then when they're going back in to be rechecked, we start to see the cervix healing. We start to see the virus going to negative. And the time frame that takes really varies based on the person. I've seen some cases that went to negative within 2 to 3 months of starting the protocol. And sometimes it takes even a year or a little longer than that. It really depends on how well we can help you to implement the diet changes, the lifestyle changes, the supplements, and so much more. You're going to find other videos from me where I go into detail about the importance of addressing the root causes of why your body's not protecting you in the first place. So it's one thing to be like, okay, we need to just take some supplements to fend off HPV. Yes, we can do that, and I can guide you with very effective clinical doses. And we have to ask ourselves, why is the virus there in the first place? Why isn't your body protecting you? Have you been exposed to a lot of stress? or trauma, and we can help you heal from stress and trauma. Are you having digestive issues that might be then, because we know that when there's gut issues like leaky gut and imbalanced microbiome in the gut, that's going to affect your body's functioning vaginally. It's going to affect your vaginal microbiome and your vaginal cells. So we need to heal your gut in order to heal your vagina. And how about your other hormones in your body? Thyroid hormone, estrogen, insulin, blood sugar levels. We got to help get those all balanced as well, because that influences your body's ability to protect you from high-risk HPV. So does any exposure to toxins, antibiotics, and other types of medications. So we need to help address all of that so that your body can do its best job protecting you from high-risk HPV. But that's absolutely possible. And in the process, you become healthier overall, right? If we heal your gut, we heal your hormones, we help your immune system, we address any nutrient deficiencies, now you're going to feel better and your body's going to protect you from high-risk HPV. So it's a win-win all around. But most of all, I want you to know that it's possible, and I'm here to guide you, and I know how hard it is to find someone to help. So I want you to know that I'm available to help you from wherever you're located. I help women from around the world. There's ways for us to get on a Zoom call so I can guide you. I can look at your diet. I can look at your supplements. I can understand what's happening in your body. I can guide you with testing to get done and help you to know how you can protect your body from high-risk HPV virus. So I'm so glad you found this video, and I welcome you to continue watching other videos from me so you can keep learning, and then you can reach out to my office and we can have a call to go over your results and your case, and we can talk more about what your needs are and how we can help you. So please know that you're not alone and you can heal, and you likely are not going to find out this information from your doctor's office. So it's time for you to get a second opinion, step outside of what the standard medical system is saying, take this into your own hands in order to protect yourself and prevent cancer caused by high-risk HPV virus. All right, well, thanks for joining me. And so you don't miss the next video, make sure you subscribe and even sign up for my newsletter. And I will then send you a newsletter every week with the latest episode of How Humans Heal. I'll talk to you soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.